Dr. Kevin Kavanagh, retired physician and founder of HealthWatch USA, joins us now. Morning, Dr. K.
Hey, good morning, Jack.
Glad to have you with us this morning. Always are. Glad you're here. Let's talk about, first of all, randomized controlled trial that was published in the JAMA network found no benefit to ivermectin. Is that possible?
Yeah, that's correct. And that's one of the first, I think, good randomized controlled trials that's out. In fact, the ivermectin group did worse. And this was looking at prevention of severe disease. 21% in the ivermectin group developed severe disease compared to 17.3% in the control group. So it did nothing. And as I said, when you pull out these lab studies or these little observational studies and all of a sudden say, hey, this drug is good and effective, well, in reality, only about 1 in 100 of those ever progresses through clinical trials and is shown to be effective enough to be used in treatment. So I would not be hanging my hat on ivermectin. I think that we'll be seeing other randomized clinical controlled trials which may possibly have the same results.
Now, does it look like there's going to be a fourth dose of the vaccine that may be recommended for everybody in the fall?
Well, and this is for everybody. If you're severely immunocompromised, you should be talking to your doctor about a fourth dose right now. In the fall, there have been some government officials that have said, well, maybe a fourth dose will be needed. To me, that makes no sense. Remember, this vaccine is based on the Wuhan original variant, and by the fall, I think this virus may be highly resistant to it. If you're going to get a fourth dose, and I'm saying if, and I don't mean for people to go out and get it, but our advisors and doctors are going to consider giving a fourth dose, I think we should be like Israel and make that decision right now, because you may get some benefit if you're in a high-risk category between now and, let's say, the time that the new Omicron variant vaccine is out, which we hope will be out sometime late spring.
All right, we've got some information about a new Denmark Sub-Variant BA.2. Is that like a meaner cousin to the .1?
Yeah, and this is very disturbing. Denmark has over 85% of their cases now are the BA.2, and this is the stealth Omicron variant. And we've talked a little bit about this before, and it does spread more. It appears to be causing more clinical disease. And unfortunately, in Denmark, there's another sub-variant of this one. So this would be kind of a meaner cousin of a meaner brother that, at least when you look at its genetic makeup, it appears to even be more pathological or maybe cause more severe disease than the stealth variant. That variant has the mutation H78Y, and it now comprises about 25% of the cases in Denmark. So if you look at what's going on in Denmark, it's very scary. Now, you can say, is that going to affect the United States? Hard to tell, but if it does, I think that we're letting our guard down right now. We need to remember the Lambda variant. That absolutely devastated Peru and some of the South American countries, but it didn't do much up here in the United States. So it's hard to tell. And that's one of the problems of looking at different countries and saying, will what's going on in that country affect us the same way? Because this virus does differ in its lethality and its ability to cause disease based upon the genetic makeup of the population, or the HLA antigens. And we've talked about a little bit of that, for example, on blood type is another example that you'll see some differences. So we need to be watching that closely. But at a time when your vaccines are waning, you've got Denmark and other countries that are having significant problems with this stealth Omicron variant, and now you have other variants occurring. It's maybe not time to completely let up on wearing masks and on public health advice, because if we are susceptible to it and this variant enters our country, we don't want to have it tear through our population like a hot knife through butter. We want to really have at least some defenses up, so we're slowing it down and our healthcare system can react to it and give out as high a level of care as it possibly can.
Always good to talk to you. We will be back with you on Friday morning, and thank you so much.
All right. Thank you, Jack.